My name is Audrey, and for this video I'm going to be talking about some of the practical applications of science as it applies to health careers. Specifically, I'm going to talk about how chemistry can be applied to the career of a medical technologist. So my mom is a medical technologist, and I asked her, how do you apply science in your everyday job? And she told me she applies it in a lot of ways through the various tests that she runs. And so then I asked her for a more specific example of how she applies science, that's something that I could relate to. And she mentioned urinalysis testing. So with that, and through her help, I was able to perform some of the tests and actually observe certain compounds in the urine that I've talked about in my chemistry class, including ketones, sugars, nitrates, and proteins. And so my next question after that was, how do they actually go about doing these tests and testing the urine? So what they do is they use these strips called multi-sticks reagent strips for urinalysis, and I thought it was interesting that they look really similar to, and it's the same concept as the pH testing strips that I've used in my chemistry classes so far. So I thought that was kind of interesting. And then next, I was really curious about what each little square on the strip tests for. Mainly, each one is used to either rule out or diagnose certain health problems or diseases. So I made this chart, which kind of shows what each one does. So the first strip on here is actually the blue strip. Well, the very first one is an ID band, so it's not really important to us. The first one of importance is the blue one, and it tests the glucose levels. So if it's positive, that can mean that the patient possibly has diabetes. Next, we have the bilirubin square, which could mean they have hepatitis if that's a positive reading. Next, we have the ketone test square, which tests hydration levels. Specific gravity could indicate kidney problems. Blood is the fifth strip, which tests kidneys, or it could mean that there's a kidney stone, which we're going to look more specifically into that test in a little bit. The sixth one is the pH test, which could indicate dietary conditions. Then we have the protein, which if there's an abnormal reading on that, it could mean the patient has a urinary tract infection. Next, we have the urobilinogen, which could indicate hepatic diseases. And then the last two, nitrites and leukocytes, both, if there's abnormal things there, could indicate infections. Okay, so to show a specific example of a normal versus an abnormal test strip reading, I ran two samples, one from a healthy person and one from somebody that we knew or thought would had some sort of kidney issues. And then here's the difference. And knowing that they had kidney issues, we would think that they would have a problem with either their specific gravity or the blood, the fourth or fifth one. So then looking here, the fifth square, there is a significant difference between the normal patient, we have that yellow color, and then the abnormal patient, which has some hematuria. It's a green square right there. So we know that there's some problems going on there. And then also we can look at it on here and see on the blood, for the blood square, a yellow would be negative, no problems, which we saw in the normal patient. And then green, the color we observed in the abnormal patient was close to this shade of green, which means they have a small amount of blood in the urine, which it turns green because of the hemoglobin present in the blood, and then the reaction that makes it turn green, we see that green color and we realize that there's some kind of problem going on there. So that's just one example of how medical technologists use science in their daily work and how they apply it. And I just thought it was really interesting that a test so simple, just a little strip, and so quick, this took us only about 5 minutes, could really reveal so much about a person's health and any problems that they may be having. And something so simple can then go on to diagnose or rule out diseases and really help people and help their health.